I'm Dr. Simpson. I'm a medical physician. I'm boarded in internal medicine, emergency medicine, and age management medicine. I serve as the medical director of Intelligent Health. First of all, a tree metaphor is a good way to understand healthcare in general for people. If you look, there's roots, there's a trunk, there's all the leaves. Most of modern medicine, unfortunately, is sort of in the treetops. They're looking at, this is where you have all the different specialties. You have rheumatology, gastroenterology, orthopedics, etc., etc. And us medical folks are very good at putting names on things. So everything usually ends in itis, which is really part of inflammation. So you have gastritis, duodenitis, rheumatoid arthritis, and on and on and on. When you actually look at what's happening, the trunk can really represent the increasing inflammation, which we realize now is a common final pathway to all disease. But the truth is there's only half a dozen root causes of all disease. And so Intelligent Health, rather than focusing on all these leaves at the top of the tree, is really focused on looking at the root causes. To be honest, genetics is just 15% of the issue. We talk about, I usually explain, look, genetics loads the gun, but your lifestyle pulls the trigger. So just because your mother and father have diabetes, that's not destiny. It doesn't mean you're going to have diabetes. Yes, you're slightly higher risk, but depending on what you do on a day-to-day level, it has everything, because we know that we can turn on and off our genes. The whole science of epigenetics, shows very clearly that we can turn on our longevity genes, or we can turn on our killer genes, depending on what you put in your mouth. So it's very important that we see this in a whole new way of healthcare.
What are you mad about?
I think we've lost our way in healthcare, to be honest, and probably mostly because of a number of years ago, maybe 50, 80 years ago, we could have gone right into the nutritional world or sort of left into the pharmaceutical world. And that, unfortunately, we took the wrong turn. And we don't need 16 or 20 drugs. Most senior citizens now are taking 16 to 20 drugs, most of which you don't need. Doctors have been bamboozled as well by very self-interested groups. Now, it's not just big pharma. Over 90% of the food, for instance, Americans eat are made by 10 companies. They do not have your health at heart. The average American now will eat 58% of his calories every day as ultra-processed food. What is processed food? It's essentially food that we've screwed up.
Okay. So where would you like to make a difference?
Okay. What I'm really passionate about and what I really want to make a difference in people need to understand that insulin resistance, if you talk about cardiometabolic disease, most people don't quite understand what that means. But truthfully, 80% of what all us physicians see every day in offices around the world is due to insulin resistance. What we need to do is find a simple, inexpensive way to change this. And often just, I believe, the mothers in the kitchen, whoever's in charge of the kitchen, is much more important than any doctor or hospital on the planet. Because with a simple understanding of what's helping us or hurting us, they can make a tremendous difference. And we as physicians need to take some leadership.
When I interviewed you on the radio, you mentioned once that in the previous century, 100 years ago, most of the diseases were infectious diseases, and now most of them are preventable, self-inflicted diseases. Would you like to comment on that?
What we're experiencing now, when the average American will have 160 pounds of sugar per year and 200 pounds of grain per year, that is really what's happening. Most of those grains get converted into sugar. And with all the processed food, these are the major lifestyle issues that are hurting people. Obviously also stress. Stress You know, we know we're living in an increasingly fast-paced world, etc. like that. So I think that stress and nutrition are probably, you know, two of the most important things to address. Sugar is more poisonous than alcohol and cigarettes combined. It is the single biggest problem on the planet today. I would advise people going back to the original human diet, the paleo diet, meat, fish, fruits, veggies, eggs, nuts, you're good. Know how many grams of carbohydrates you're putting into your body each day. In fact, the amount of carbohydrates you put in your body is going to determine the quality and the length of your life. Back in the 70s, 1970s, two Japanese researchers developed high fructose corn syrup, which became the fastest sweetener worldwide. And obviously, what's in the Coke, it's not from the cane sugar of before and things. Now, most of the sweeteners in most processed food, including all sodas, is really high fructose corn syrup, which is particularly dangerous because it goes directly to the liver. It doesn't get metabolized by all the cells in the body. Glucose is taken up by all the cells in the body. Fructose goes straight to the liver and is really the prime cause of this insulin resistance. So that's why I say, you know, sugar is what makes us fat and sick. And we need to educate our kids, our mothers in the kitchen, etc.
You know, what I'm mad about in my profession is my staff being productive and happy about what they do.